Hi everybody, Dr. Nayo here with another video again for Rutha Health University. So today we're going to talk about how do we support longevity and vitality through a really potent antioxidant called glutathione. So we're going to dive right in. So what is glutathione is the first thing we want to answer, correct? Glutathione is one of our most powerful antioxidants that our body makes and has access to turn off oxidative stress. This is really important. It's often called one of our master antioxidants. When you think about an antioxidant, I want you to think about it as it's a neutralizing agent that has the ability to dampen down oxidative stress. And I've spoken before about oxidative stress, and really the simplest way that I like to speak to clients about this is it's if we've got chronic inflammation just going and going and going, and it's creating something called oxidative stress, which creates something called free radicals, which are damaging to our tissues, and that starts to support breakdown in the body. And so when we talk about anything that's an antioxidant, it's helping to balance and settle and clear oxidative stress. So glutathione is one of the most potent antioxidants that our body has access to. And for many reasons, we're going to talk about how we can support increasing our levels and what does glutathione actually do. So I just put a little bit of an image here about free radicals and different ways that free radicals are able to develop in our body. So you had just an idea of how that happens. So it's basically any stressor on a cellular or mitochondrial level is how I would start to begin to think about oxidative stress. And what happens is there's a balance between oxidation and reduction. And I'm not going to go into deep detail about this because I don't want it to get confusing. But what happens is if there's an imbalance in favor of oxidative stress and free radicals, your body needs help to clear that. So that's what we're talking about when we talk about oxidative stress. And so your tools that your body naturally has the ability to either synthesize or to access through your diet. These are called antioxidants, and they're our friends in our toolbox that help us to be able to get this reaction of uncontrolled oxidative stress, free radicals, etc., to dampen it down so the body can heal. So glutathione is also one of the most abundant nutrients in our cell. It's as abundant as something like potassium, glucose, and cholesterol. And probably everybody knows those three nutrients as essential for cellular health. Potassium is huge on a cellular level, salt balance. It plays a role in blood pressure, so many different things. Cholesterol is huge for transporting things around the body. So without cholesterol, your body can't make hormones, it can't move things around the body. It's important for healing different tissues, etc. And then glucose, everybody knows that's an immediate sugar that your body has access to for immediate energy. So you can see that if we're comparing glutathione to being as abundant as potassium, cholesterol, and glucose, which your body cannot function without, that tells you how important glutathione is. When we think about glutathione, I put this beautiful stone picture here at the beach because this is all about balance. And you want to think of glutathione as one of those major antioxidants that your body has and utilizes in order to keep things in balance so that the tissues heal and recover, and your system in general is just able to be in a regenerative healing state. So what is glutathione actually involved in? This is a long scientific list. Don't worry about understanding everything, but I'm just going to go through it. So basically the first one, glutathione is one of the nutrients that helps to maintain homeostasis, which just means balance in the body. So helping to keep everything just working and copacetic. It's also involved in gene expression, DNA and protein synthesis. It's important in the cells continuing to grow, proliferate, and then when appropriate, if the cells are not healthy or they're aged, for apoptosis, which is programmed cell death. We also know glutathione plays a role in cell signaling, cytokine production. That's one of your parts of your immune system that's your defense. So these are chemicals made in your body, chemical messengers that help with your immune response. And so glutathione plays a role in producing those cytokines. in general, glutathione is instrumental in helping us to have a healthy immune response. I mentioned before this reduction oxidation balance, some will call it redox balance, which is when we're addressing that buildup of oxidative stress. Protein glutathination, regeneration of key other antioxidants, vitamin C and E. So one thing that you'll hear sprinkled throughout this conversation or this talk, there's redundancy in this antioxidant toolbox that we have. So there's not just one, and they all tend to work together on some level. So by utilizing glutathione, we also support these two antioxidants, vitamin C and E. We also can support through glutathione other antioxidants, which I didn't specifically list here, which we'll talk about later. Also, this is one that not everybody who's not medical knows about, but glutathione is actually helpful in chelating or eliminating heavy metals and other toxins. So for that reason, it's a really, really underutilized antioxidant from that standpoint. And then it's also essential for the health and function of the mitochondria. So if you've ever heard me speak, I talk about mitochondria so much because it's the poor health of mitochondria or the lack of number in mitochondria that are really associated with a lot of pathologic aging. So the body's starting to get older and break down is very closely aligned with declining mitochondrial health. And so glutathione plays a role in that, as well as helping to maintain the mitochondrial DNA, which is very important. As we think about glutathione, I wanted to start with just kind of breaking down how this molecule is made. So your body naturally has the ability to synthesize glutathione. That's one of the ways that you have access to this really powerful antioxidant. And it's what's called a tripeptide, which just means 3 baby proteins. Glutathione is made of the amino acids cysteine, glutamine, and glycine. All 3 of these make up glutathione. We also know that riboflavin or B2, vitamin C, and selenium are also required for glutathione production. So that's important because a lot of times people, if you're not eating a really nutrient-dense, colorful diet, you can miss these nutrients. And these two, incidentally, vitamin C and selenium, they're also antioxidants. Another thing that we should speak about is NAC is a supplement that a lot of us, especially in the medical world, utilize a lot. It's called N-acetylcysteine. It contains cysteine, and cysteine is really important, and I'll speak about it in just a minute because it's a precursor to glutathione, which is here, but it's a rate-limiting precursor, and I'll talk about what that means in just a minute. But NAC itself is a supplement that sometimes people will take to try to support their glutathione levels. Sometimes this may not be enough because if you don't have the ability to make the other two or to absorb and integrate the other 2 amino acids to make glutathione, just giving NAC alone is not always enough. I do love NAC though, because it's really important for liver health, as is glutathione. It's also a biofilm buster, which means for people who have different infections that are chronic and are very difficult to clear, like Lyme or mold or something of that sort, our body can create things called biofilms, which make it where these organisms can hide, and it can make it very difficult to actually treat whatever the infection is that we're looking at. And NAC is one of those nutrients that is also a biofilm buster. So I a lot of times will use NAC with glutathione, but I just want to bring it to people's attention because we used to use a lot of just NAC alone in order to get people's glutathione levels up, but sometimes that's not enough of the case, but it's still useful as a biofilm buster. Another nutrient that's really important for helping with glutathione production is alpha-lipoic acid, one of my other favorite supplements. It is another antioxidant that really supports decreasing that oxidative stress and free radicals that result from that. It also is going to help you indirectly make more glutathione. And then finally here I put turmeric, which is a natural compound that's a natural root. contains a compound in it called curcumin or curcuminoids, which also may help to boost glutathione levels. So this is turmeric right here. It's just got that beautiful bright orange color. And one of the things I'll say, since I just mentioned that, one of the ways you can know whether you're getting a lot of antioxidants and phytonutrients in is the more colors that you eat from the color wheel from plants, the more you are going to be taking advantage of more and more of those phytonutrients that work together synergistically. Okay, so this is a long list of potential diseases and illnesses that can be associated with glutathione levels. So we have a couple cardiac things here: heart disease, high blood pressure, musculoskeletal diseases and joint pain, diabetes. This is a huge one. Neurodegenerative diseases like Alzheimer's, Parkinson's, Huntington's, etc. This is important because remember I started off by saying that one of the things that I mentioned that glutathione helps with is mitochondrial health. And you can see neurodegenerative diseases, which are here. Mitochondria is one of the reasons, or the lack of the health of mitochondria is one of the reasons that we see more and more neurodegenerative disease as we age. So we're going to talk a little bit about getting glutathione levels up to help with that. COVID patients or vaccinated patients with COVID, there has been a little bit of research to show that people who have COVID, their glutathione levels decrease as a result of that, of an infection. Lung disease, both COPD, asthma, and ARDS, all of those, or ARDS, they all are associated with lower levels of glutathione. And glutathione is another nutrient that is very healing for the lungs, as is NAC. They're directly healing to lung tissue. Liver disease, this is one of the disease states that glutathione got some of its legs with. It's very good for helping with liver health, cystic fibrosis. And then I put pathologic aging. So if you've done any listen to any of my other talks, in most of them I'm always talking about something called pathologic aging. So we're all hopefully going to get older, but the key is not to age, which is a pathologic process where things start to break down at an accelerated rate. So that's why I make the distinction between getting older and pathologic aging. A lot of people put so much stress psychologically, physically, emotionally on themselves that they start to get more into a pathologic form of aging, which is accelerated instead of just getting older. Autism has also been seen to be associated with low glutathione levels, leukemia, a couple of ocular issues, macular degeneration and cataracts, genitourinary disease, chronic kidney disease. HIV and AIDS is another one of the first things where glutathione was found to be low. Hearing loss, brain fog or cognitive decline, mast cell activation syndrome, mold, heavy metals, and any other toxic exposures also oftentimes are going to be associated with lower glutathione levels. Migraines, and again, recurrent URIs or viral issues. Respiratory tract is very amenable to glutathione. And remember, I also said NAC, N-acetylcysteine. So this is oftentimes found to be low when people are going through an acute upper respiratory illness. Additionally, people who have low or poor immune health or autoimmune disease, they also tend to be people who have lower glutathione levels. And then anxiety and depression also have been associated with lower glutathione levels. Now, glutathione and pathologic aging. So I started speaking about this a little bit. And again, pathologic aging is when we're aging in an accelerated way where we're losing function and starting to see the breakdown in the body. This particular way of moving through life is associated with lower glutathione levels. So anything that is associated with this more accelerated aging are going to be things like neurodegenerative diseases. So those are diseases in the brain and the nervous system. Anything that's associated with your immune system or autoimmune diseases, lung diseases, cardiovascular disease, which is not just high blood pressure, heart attacks. It's also the oxidation of cholesterol, which means So remember, I mentioned cholesterol at the start is a really important, healthy molecule and vehicle that our body is using to move things around the system for communication, etc. When the cholesterol gets oxidized, again, so we talked about oxidative stress, which is if it's an ongoing, unchecked process, is damaging and supports breakdown. So if we have too much cholesterol oxidation, what it means is that there's not enough balance in that system between reduction and oxidation, and it's supporting too much breakdown. And so we want to make sure from that standpoint as well that we're providing balance there. And this is one of the things a lot of times we will not see in pathologic aging. So the more that we can bring balance with glutathione and other antioxidants, that will help a lot to kind of dampen that response. Macular degeneration, cataracts, hearing impairment, glaucoma, liver disease are also diseases of pathologic aging that also tend to have lower glutathione levels. So the more that we can support these chronic inflammatory processes by getting at the root cause with your functional medicine provider, and as one of our tools that we may utilize as we're working on that, glutathione can be very helpful. But the key ultimately is not just throw glutathione at everything and that's it. It's glutathione, and then why is the system aging in a pathologic way? Why is there a loss of function? Why is there chronic inflammation? These issues have to be addressed and really can be with your functional medicine provider. But in the meantime, while we're sorting that out, adding glutathione can be very supportive. So what else can we see with glutathione? A lot of times with people who have lower glutathione levels, as I've said several times now, you'll see the loss of mitochondrial function, which could show up with decreased energy. It could be more pain. It could be more headaches and migraines. It could be more mental health disease, anxiety, depression. So there are a lot of ways that mitochondrial decline in function and health can show up. But pathologic aging and all those things I just mentioned are some of the things that you can recognize. So most people wouldn't think of pain or headaches or lack of energy as mitochondrial problems, but that's what they are at their core. So as we're sorting out why is the mitochondrial function declining, adding some glutathione can really be helpful. DNA damage is another thing you're oftentimes going to see when people have lower glutathione levels. And this has also been noted to be important because glutathione levels has been found to parallel telomerase activity. Telomerase activity, if you haven't heard of this before, telomeres are ways that we look at longevity, vitality in people. And as the telomeres shrink, or people have shorter telomeres and less telomerase activity, that is an indication of that they're aging at a faster rate and may have a shorter lifespan. So, and that's the result of DNA damage. So what they're finding is that glutathione levels being lower can parallel somebody who's not going to have healthier telomerase activity and therefore possibly a longer health span and less pathologic aging. So the bottom line is that if you have lower glutathione levels, you may start to lose your mitochondrial function. You may also start to have more DNA damage. Now, these are not causation, meaning the low glutathione alone is the cause of these two issues, but it's not helping that there's not the support from a glutathione antioxidant perspective to help. Then we see with higher glutathione levels, when we look at people, they tend to report or to have better physical health. They tend to not get ill as much, and their health status as they report it tends to be healthier. And I can just say to you anecdotally, as you know, an individual, I've used glutathione probably for the last 15 or so years, not all the time. And I use it as more of a regular part of my regimen now, knowing a lot of this and knowing anecdotally through myself and through my own patients, seeing that it does play a role in detoxification, longevity, mitochondrial health. And I will say with my patients, particularly clients that I've seen that have been not as well, glutathione has always been in kind of the foundation of supporting healing. So it's something to really be aware of, utilizing glutathione. What else do we want to be thinking about? Well, I put this image here of these rusty trains because that's what I really want people to think of when they're thinking about oxidative stress, loss of mitochondrial function because of oxidative stress, that it's the breakdown of something. And how does this look? So we can't see this necessarily immediately with people, this because it's internal, it's an internal process. But if you can kind of bring this image up for yourself whenever you're thinking about oxidative stress, it'll help you to think about a lot of different disease states: cardiovascular disease, inflammation, brain health issues, and what that could be, mental health or cognitive decline. If you start to think about, is the system getting rusty? And how can I support reversing this pathologic form of oxidative stress or rust? That will help a lot. So one of the things your functional medicine doctor may do is look at a GSH to GSSG ratio. So this is looking at two of the forms of glutathione. Our body is always kind of having this play between the two forms of glutathione. The first is reduced, which is GSH, and the second is oxidized, GSSG, which is two reduced form molecules of glutathione bound by a sulfur. And so what we can do is look at the ratios of these two types of glutathione and have an idea as to how likely is it that you're more in an oxidative stress state or versus a more healthy, balanced state. And so what we're looking to see with a functional medicine provider who can test this for you is to see that your level's 100, because that's more likely indicative of having healthier cells that are spending less time in an oxidative stress pattern. Now, I don't want to give the impression that you don't want any oxidative stress, because it's a balance. It's a balance between oxidative stress and reduction. We want this kind of back and forth, this delicate interplay, but you don't want it like this with oxidative stress being like that. And so cells that are under a lot of oxidative stress on an ongoing basis, that ratio is generally going to be somewhere around 1 to 10. So this is something I mentioned kind of earlier that we can be looking to help us really kind of see where could the cog be in the system in terms of you being able to have optimal glutathione levels. So how do we produce it in the body would be the first question. The first way is what we call de novo synthesis, and this just basically means your body's making it from scratch using amino acids and sugars. All of these forms are going to require energy, so that's one thing that we want to always be mindful. Every reaction in the body costs energy, and so this form requires ATP as its form of energy. The second way that we can make glutathione is through regeneration of the oxidized glutathione to make reduced glutathione. This requires another form of energy called NADPH. And then the last way to do it is to recycle cysteine from conjugated glutathione, and this also requires the energy NADPH. All three are important and all three are necessary. The thing that I wanted to really point out here is that cysteine, which is that amino acid, remember I said glutathione is made up of 3 amino acids: glycine, glutamine, and cysteine. Cysteine is the rate limiting step in glutathione production for de novo synthesis of glutathione. So if from our diet we're not getting enough cysteine, or it's coming in through our diet but we're not able to absorb it, utilize it for whatever reason, then this can be a cog in the wheel as to why just giving somebody a lot of NAC or having them eat a lot of cysteine rich foods may not be enough to help them. So let's talk about glutathione and its role in preventing or helping with detoxification and serving as an antioxidant. So one thing that I want you to know that's beautiful about glutathione is that it can bind fat-soluble toxins as well as heavy metals in both and support kidney and liver detoxification. Why is this important? We know that the environment is becoming more and more toxic with, different chemicals that are in the food, the air, the water, everything. And we need to support detoxification to let that go. But it's one of the ways that it's hard is to get toxins out of the fat. So we know that when people are overweight and they've got a lot of fat, when they lose weight and lose that fat, the toxins are then released into their system. And so there needs to be some support that your body naturally has to be able to pull fat soluble toxins out. And so glutathione is one of those that can do that. It also has been able to get at some heavy metals, and it's very important for kidney and liver health. It also supports what we call phase 1 and phase 2 liver detoxification. So our liver is just another majestic organ that is really helpful in just keeping balance in the body. It's brilliant the way that we're designed. And so there are 2 phases of liver detoxification. Glutathione has the ability to support both. So again, it's really, when you hear a lot of redundancy, that something is able to be made multiple ways, or it's helping at different levels in your system, it's a really big context clue to let you know this is something that's integral for health. Another thing that we know glutathione helps with is scavenging oxidative reactants, which are better known as free radicals. I mentioned earlier, it helps to recycle both vitamin C and E. This is important because both of these antioxidants protect the cells from oxidative stress. I also mentioned earlier that glutathione can support programmed cell death or apoptosis if they're exposed to too much oxidative stress. And this only is going to happen, though, typically when glutathione levels are low. So one of the ways that you can prevent unnecessary damage and or having to have programmed cell death at an accelerated rate is to optimize glutathione levels so that doesn't have to happen. So glutathione is also really important from an environmental exposure standpoint. We have something in the environment that are a class of toxins called persistent organic pollutants. We call those POPs, and they're ubiquitous. Glutathione can help to get some of those down. Xenobiotics are things that look similar to things that our body can deal with and handle, but they're foreign. And so they don't have quite the reaction that an actual compound would have. And glutathione can bind those. Also can bind the heavy metal mercury, oxidative chemicals, and endogenous metabolites, which just means fancy breakdown products that our body is utilizing as it's, doing the daily business of taking care of us. If these are not naturally being eliminated through our kidneys and liver, glutathione can help to bind them and to eliminate them from our system. So what depletes glutathione? I just want to leave you with, just think about anything that is a form of stress. Think of that as being depleting of glutathione. So that could be psychological, emotional stress, oxidative stress, alcohol, smoking, aging, heavy metals, toxins. I mentioned kind of having certain infections like COVID have been shown to have been associated with lower COVID levels. So anything that's very challenging or stressful to your system may be supporting decreased glutathione levels. So glutathione in optimizing health are important for all the reasons I just mentioned, but very importantly to maintain the health of the individual cells and the mitochondria, because that creates health in the whole being. So think about it first on a mitochondrial and a cellular level, and then translate that on a global level for the individual. So the more you help the cell and the mitochondria, the more you help the entire being. Glutathione also supports kidney function and health and immune system health. So what other nutrients will support glutathione levels? So vitamin D helps to upregulate something called a GGT gene expression and activity. So GGT, we're going to talk about in a few minutes, but this is one of the ways that your body is going to help make glutathione. And there was one small study that showed that when you give people vitamin D3, it helped in the brain tissue. Astrocytes are the specific cell that we were looking at. We saw increased glutathione levels, which support brain detoxification. Now you think about the brain as just a very important organ to be protecting. And for that reason, most of you probably know you have something called a blood-brain barrier, which is very fickle and doesn't want a lot of things to get past it, because that brain tissue is just very sensitive and can be disturbed easily. However, there are things that we're finding more and more, probably because of the level of exposure and just, the environment and then stress itself. More and more things are finding themselves being able to cross the blood-brain barrier, which impacts brain health, cognitive function, etc. So what we're finding is that if you give vitamin D3, it is one of the things that can help to augment glutathione production in those tissues. Vitamin C was also shown in a study to increase red blood cell glutathione levels. So this is actually your red blood cells is a good way to measure glutathione production. And what they found is that in people in this small study that received 500 milligrams of L-ascorbate, which is a form of vitamin C, their red blood cell glutathione levels went up 50%. That's impressive. So just a little bit of vitamin C, another antioxidant, seem to be helpful from that standpoint. And then vitamin E, that's another antioxidant I mentioned. And a small study showed that for patients who had diabetic neuropathy and were in this study, if they received 800 IUs of vitamin E compared to placebo for 12 weeks, there was a statistically significant increase in plasma glutathione levels. Again, very important because this translates in turning down oxidative stress, as well as helping to address some of the changes that we see with the morbidity and mortality of diabetes. So really impressive to see in just a short amount of time adding nutrients that aren't even actually the direct precursors of glutathione helped people to actually increase their glutathione levels. Okay, continuing with other things that support glutathione production, which are not direct precursors to the antioxidant. We have cobalamin or B12. So this was found to support active status of antioxidants. And one of them includes glutathione. And you can see that there's this form of glutathione, glutathionol cobalamin. So the cobalamin had this glutathione group with it. And that was found, this particular antioxidant was found to be really helpful in early stages of inflammation. So just by getting B12 levels up, you might be helping indirectly to support glutathione levels. L-taurine is another amino acid. It helps with glutathione stores. It mitigates oxidative stress. If you give people taurine as the form of a supplement, this also can support increased glutathione levels by supporting the cysteine. Remember that rate-limiting amino acid your body needs to synthesize glutathione. So again, another indirect way that we're seeing different nutrients can very favorably affect glutathione production. And remember, this matters. Glutathione is a master antioxidant. So think about that, a natural neutralizing agent to turn off oxidative stress and the damaging effects of that. So every time I'm saying this, why do we want to get your glutathione levels up? Think about that. It's a master antioxidant that helps to turn off oxidative stress and support more of a healing pattern in the body. Not to mention it helps to support liver detoxification, which is also huge. Then lastly, I have here, there's a small randomized trial that looked at if you gave people whey with zinc and selenium to other antioxidants, I'll call them zinc and selenium. When you added the zinc and selenium to whey, in this small subset of people, 23 was the total number of cancer patients who were given this protein, the whey protein isolates with zinc and selenium, they had an increase in glutathione levels as well. And remember, selenium is one of those antioxidants that's required for the production of glutathione. And then zinc is very important too because it's a huge antioxidant and nutrient that's important for immune system health as well. So that's, again, we're not even talking yet directly about taking glutathione, and we're seeing that we're increasing glutathione levels just with nutrients found naturally in food. So how can we measure glutathione? The quickest way that I like to just assess this in almost all of my patients is to do an indirect test called GGT, or gamma glutamyltransferase. Now remember, I mentioned this one earlier because this is one of the enzymes that is going to support glutathione production. So it's a very inexpensive way to assess, does somebody likely have a heavier or higher demand to have more glutathione either directly given to them or to figure out what is going on in their system that is having them have high GGT levels. Because a high GGT level, anything above 30 in my book, really I'm picky with my clients. Usually if you're above 20s, I'm looking to put you on some glutathione and figure out what's going on from a toxicity, chronic inflammation, oxidative stress perspective that your GGT is so high, because it's telling me something is really a mess. And so GGT specifically provides the rate limiting amino acid cysteine, which is needed to produce glutathione in the body. So, but it's a very strong, direct way to be able to assess whether somebody needs help from a glutathione, detoxification, oxidative stress, even diabetic standpoint. So we see GGT increase with metabolic disease, diabetes, cardiovascular disease, those environmental pollutants I mentioned, POPs, toxins, high blood pressure, and on and on and on and on. And so one study showed that people with a GGT about 30 to 40, which is normally, if you went to a normal lab, that would be within normal limits, the range that would rate as normal. They found that these people had 2 times the risk of all-cause mortality. Another study showed that when men had GGT levels 40 to 50, they had up to a 20-fold increase in developing diabetes. And I've also seen this in my patient population. And as I understand it, basically what's happening is we're seeing some form of insulin resistance, toxicity, oxidative stress kind of mixture going on. And as a result, we're seeing it show up with this GGT level being higher and higher and higher, which is really like a loud call to us figure out what's going on here, because these people really need glutathione, and there's a lot in the system that needs support. Direct ways that you can be measuring glutathione activity. This is something typically, specifically your functional medicine provider would have to order for you. You can get a red blood cell reduced glutathione level. You can also get blood glutathione peroxidase levels to look at glutathione activity. Other indirect ways that you can get it are that level that I mentioned before, to get that ratio GSH to GSSG. So looking at the oxidized and the reduced states and getting an idea of what are the glutathione needs there. You can also check a serum or plasma cysteine, which is, remember, that amino acid. It's the rate limiting step that is required to produce glutathione. That's another indirect way to check. And then you can look at urine mercapturic acids, and if they're low, that suggests that there may not be enough cysteine available in the system to make glutathione, or not enough glutathione directly. So these are ways that your functional medicine doctor may order as part of a panel or as standalones to help you to understand your needs for glutathione. Typically, we're going to start to get into this when we've got people with more chronic degenerative type diseases going on, or a lot of pathologic aging going on. A lot of times, just starting with that GGT that I mentioned and a good history is going to be a good way for us to know, all right, we want to add some glutathione here. Let's talk about how would I begin optimizing glutathione levels for folks. So I put together this little spreadsheet to kind of help you see different ways that functional medicine providers may be thinking about how to help you optimize glutathione levels in a very well person who's just really interested in supporting optimal glutathione levels and healthy, just moving through life healthier. Then I'll kind of point out those levels or those specific supplements that may just be just for maintenance and support. When we start to think about people who have more chronic neurodegenerative diseases, immune system issues, metabolic issues, oxidative stress, etc., then we might be doing multiple strategies. So the first thing that we have up top here is glutathione. This is the oral form of glutathione that I have here. I typically use a liposomal form of glutathione, which means that it's easier to absorb through the oral mucosa. So that's typically where I'll start in a healthier person. And I'll start anywhere from 500 to 1,000 milligrams a day, sometimes twice a day in somebody who may not be ready to do IVs, but wants glutathione support, or it can be a part of protocols like a mold protocol or a Lyme protocol. You may have oral glutathione a couple times a day, but that's an easy way to get glutathione in. And it tends to be pretty well tolerated if you take it orally at a lower dose. Then we have selenomethionine. This is a well absorbable natural form of selenium that your body can utilize very well. So typically I would have this either as a standalone, with clients taking about no more than 200 micrograms a day without checking levels. And that's across all supplements. For selenium and zinc, you want to kind of look across all supplements to make sure you're not going above the dosing, because it's not like a B vitamin where there's a little bit or a lot more room for error. If you kind of take too much, you'll just urinate out excess B vitamins. But selenium and zinc, they're a little bit tighter. So you want to not go above 200 micrograms a day unless you're working with a functional medicine provider to make sure that that's not too much. But remember, I said selenium is a cofactor that's needed to make glutathione. It's also another really potent antioxidant, also another nutrient that's essential to immune cell health. It's also important for reproductive health, skin, hair, nails. So it's a really important nutrient. So that's very helpful as well. Now, one of the ways I will get glutathione into my clients, once I know that, they're somewhat stable and they're not coming into me super sick, then I would be thinking about doing glutathione IVs. And that could start at a dose as small as 500 milligrams up to 3,000 milligrams a day, split between 1 or 2 times a week, depending on the person's schedule and what their health status is. Because you don't want to start with a lot of high dose IV glutathione if a patient's detox pathways are not open. So anytime you're doing a glutathione based IV, you really want to be working with a functional medicine doctor or provider that is really well versed in glutathione IVs to know the appropriate dosing and frequency to be tailored. If you're healthy, most people will be fine doing 1,000 to 2,000 milligrams a week without any problem. It's the people who have some of those chronic disease states that I was mentioning earlier that if you give it to them all of a sudden, it can be overwhelming for them to support detoxification. Next, we have NAC or N-acetylcysteine. This, remember I said a lot of people give this to clients as a precursor to make glutathione. Not everybody can do that, but it's still definitely a supplement that's in my toolkit because it is a biofilm buster. It's also very good for respiratory health, so giving it to people appropriately when they've got an upper respiratory infection can be very helpful as well. I tend to start, it's also really good for PCOS. I also tend to start this anywhere between 600 to 1,800 milligrams, either once or twice a day, depending on the scenario. So you may see your functional medicine provider recommend that one. Vitamin C, another antioxidant that I mentioned earlier, I start it anywhere between 500 to 1,000 milligrams and to do it through a couple times, 2 to 3 times a day. If you try to take too much at once, so I would not take 2,000 milligrams at once, that would actually be split dosing between 2 or 3 times periods during the day. Vitamin C is one of those that there is a max dose, and if you take too much, your GI system won't tolerate it, so you'll just get loose stools. So you want to give the dose that your gut can absorb it appropriately, and then split the dose throughout the day. But this is another really important antioxidant. Glycine, remember I said this is one of the amino acids that's a precursor to making glutathione. So this is something that a functional medicine provider may add anywhere from 3 to 8 grams a day. Methylfolate is a form of folic acid that's methylated, means it's putting on a carbon and 3 hydrogens for people who may have a genetic change that doesn't allow them to do so. So that's called a methyl group. And so I usually, unless I'm doing something specific for heart health or another reason, a lot of times I'm going to do either activated B vitamins or methylated B vitamins in a complex or a combination supplement, so to cut down on the number of supplements that people have to take. L-taurine, remember I mentioned this one. This is an important amino acid. You can take anywhere from 1 to 5 grams a day as directed by your provider. Curcumin, remember this is the group of compounds that I mentioned that comes from turmeric root. It's got that beautiful orange color that is helpful in boosting glutathione levels. It also itself is anti-inflammatory and supports liver detoxification directly. So it's a really potent nutrient to get in even beyond glutathione production. So I'll start anywhere between 5 to 2,000 milligrams a day. And in some people, if someone's really inflamed, I'll get them up to 4 grams with a split dose a day. but that's another potent nutraceutical that people can take. Alpha-lipoic acid, another great one. Helps with oxidative stress, can help with blood sugar regulation. So you want to start at a lower dose, and this is one that can alter blood sugar levels. So you do want to have this dose by your functional medicine provider. So somewhere between 200 to 1200 milligrams a day, definitely starting at a lower dose. Then we have magnesium, my favorite supplement. So magnesium has been found that up to 70 to 80% of Americans are either insufficient or deficient in magnesium. And magnesium is involved in over 300 reactions in the body. So being depleted in magnesium is really not ideal. It doesn't help with the heart, the brain, blood sugar regulation, your bowels, your bones, so many different things. So again, this is definitely going to be one that's tailored. You're going to start somewhere around 2 to 1200 milligrams a day. Remember, I mentioned riboflavin or B2. This is one that is another cofactor for producing glutathione. So I typically are going to have people take this in the form of a multivitamin or a B complex. And then lastly, vitamin D. I have a wide range for the dosing of D3 here because the time of year will matter on how much D3 you need if you're getting outside and it's the summer. But also there are mutations where certain people don't absorb it as well. There are also, depending on the amount of melanin in your skin, you may need more because you're not going to get as much from the sun. So that is another one that needs to be really tailored by your PCP. So I would never have anybody start on every single thing here at once. Generally, depending on the health status, if they're pretty sick, I'm going to go slow because the more you add, it just takes time for people's systems to be able to adapt and to kind of adjust and accept more and more. And a healthy person generally aren't going to need a ton. So like a good multi or a good B complex with some glutathione, that can be enough. So it's really something that's going to be individualized, but this is a key table that can really help you to understand how you can start to support your own glutathione levels. All right, so guidance around using glutathione in cancer patients. So this is definitely not my wheelhouse, but I have come across several colleagues over the years who are either oncologists and are also trained in functional medicine, or the functional medicine doctors who specialize in supporting oncology patients. So I just wanted to put this cautionary note in here because I got a lot of clients who would come in to see me specifically to get glutathione who either were going to forego chemotherapy or they wanted, in preparation for their cancer treatment, they wanted to get glutathione on board. And it's a little bit controversial because glutathione can both help prevent cell growth or it can support progression of cell growth. And so it's not always clear. So that's why you need someone who really, truly specializes in whatever form of cancer a person has to be able to know when and how to add glutathione. And the other reason that I put this cautionary note in is the oncologists don't want it on board a lot of times because it can support resistance to some chemotherapy drugs. So you definitely want to have an expert in both functional medicine and oncology if you're going to add glutathione and you're experiencing cancer. However, it does remove carcinogens in helping to prevent the development of cancer. So my kind of rule for my clients was let's not do it during active treatment unless you're involving a specialist, somebody who does this every day and they kind of know when it's appropriate to add it versus to not have it on board. And this is my rule. I kind of sprinkled this in earlier. Severe or chronic unstable diseases like mast cell activation syndrome, chronic Lyme mold, heavy metals, etc. These people who've had chronic exposures or chronic disease, a lot of times these are people who will not tolerate if you all of a sudden started giving them a lot of glutathione and you haven't done the work from a detox standpoint as a functional medicine provider to help them to open up their detox pathways, make sure that you're starting to get their gut healthy, looking for any major kind of red flags for a functional medicine provider that may need them to kind of start with supplements and detoxing through their nutrition first. Because if you just put something as potent as glutathione on board without supporting in the other ways, and they don't have the sustenance to be able to deal with that, meaning open detox pathways, other nutrients are on board to help with the whole process, it can be overwhelming and it can really turn those clients off. So if you're one of those clients, just kind of talk to your doctor about that and they can really walk you through that very well. Let's talk about how you can get some of the supportive nutrients in through your diet. So I've already told you that glutathione is a tripeptide that has cysteine, glutamine, and glycine. Cysteine is most readily available in your protein, so lentils, beef, poultry. I'm not a fan of pork, so that's why I put it in parentheses. I don't think it's the healthiest food to be eating. But also in seaweed, peas, mustard greens, asparagus. Glutamine is very readily available, but you want to get it from non-GMO forms of food. The reason I point that out here is corn and tofu, which are forms of food that you could get glutamine from. A lot of them, especially soy, most of it is genetically modified, and a lot of the corn is as well. So you kind of really need to be careful of these foods. Where are you getting them from, and are you sure they're GMO? Because otherwise you're getting a toxin trying to help yourself, and you don't want to do that. And then eggs is also another common source that you can find glutamine, milk, white rice, protein in general. And then glycine is going to be found in animal collagen. We see in people in very high stress states, their glycine is depleted. And so glycine is a really important one that we'll use a lot of times when there's a lot of stress going on in somebody's system, and it's very good for the brain as well. Other supportive foods that people could add to help with glutathione are the alliums, which is going to be like your garlic and onions, avocados, watermelon, pomegranates, mushrooms. Those are all supportive. Eating lots of fruits and vegetables. It was found that up to 50% of glutathione produced from the diet was produced as sulfur. So that's mostly when you're thinking of high sulfur foods. So glutathione is a sulfur molecule, in case I didn't mention that. The more you're looking for a sulfur molecule, you want to be plant heavy. Not saying no meat, but that's where you're going to find a lot of your sulfur rich nutrients. So think very big portion of your plate dedicated to mostly vegetables, I would say, but a lot of colors. And then meats only account for about 25% of the dietary source of glutathione as sulfur. So really just making sure when you're thinking about designing your plate for your meals, having lots of beautiful, rich colors, which are going to be rich in lots of antioxidants and phytonutrients, but likely also some of the healing compounds that your body loves. And then another way that we can increase glutathione production is through exercise. So exercise directly has been found to increase glutathione production. It's usually going to be doing some sort of form of moderate to high intensity exercise, but it needs to be done in the right quantity and intervals. If you're over exercising, this is going to increase oxidative stress. All exercise, frankly, is going to increase some oxidative stress in the body. Remember, I said some oxidative stress is fine. It's just you don't want to be pushing the balance towards excessive amounts of oxidative stress. But there's a lot of trend toward over exercising and this long endurance exercise. And we see increased oxidative stress a lot of times in these clients who will have higher free radical levels. And that moves you away from helping to produce increased glutathione levels that help to neutralize that. So who would benefit from glutathione? Most people, to be honest. Stress clients are a lot of the people that I would see come in because there was just with demands that people are having now, they're burning through glutathione more quickly. Anybody who's got signs of oxidative stress on their lab tests, so that could be on a heart test, you could see high levels of F2 isoprostanes, which is an oxidative marker. High A1C could be another oxidative stress marker. A1C is also, when it's high, obviously an indicator of insulin resistance and possibly diabetes. Smokers and those with high alcohol intake, because they're depleting their glutathione levels by partaking in those substances. Elderly people in general may also benefit just because they may not be making as much glutathione anymore. Most likely they're not. The big thing you have to be assessing with everybody is, can they do an IV, oral, and how much of a different supplement can they tolerate. Other people who I would consider doing glutathione are healthy individuals who exercise a lot, COVID patients or COVID vaccinated people, clients who have a lot of recurrent upper respiratory illnesses, anyone with any poor immune health or autoimmune disease. These people in particular tend to be sensitive, so you want to go lower and slower. Individuals with anxiety and depression, any brain fog or cognitive decline, that glutathione is one of the things that may be helpful. Individuals with mast cell activation, mold, heavy metals, or any toxic exposure. And then clients just needing more support to support detoxification, gut health, dermatologic health, because our skin is our largest organ, and a lot of times I'll have clients coming in to address something in the skin, but that's really an extension of the gut and their immune system. So by supporting detoxification, we may support their skin as well. And then clients with headaches or migraines, this is another big one with glutathione. Migraines is big too with glutathione. It's complex. There are a lot of things that are probably playing in that would make that important for migraineurs. But the other thing is it's a mitochondrial issue a lot of times, but it can also just be some specific toxin that is not helping as well. And then I like for my ladies who are going to get pregnant 6 to 12 months from now to do it so that their detox pathways have been supported. They've let go of some toxins before they try to conceive. Who should not get a glutathione IV? I think this is someone who I've mentioned has active cancer. They need to be under the care of an oncologist or somebody who knows specifically their form of disease. Anybody who's unstable. And that could even be somebody with uncontrolled diabetes who has, a really high A1C, anything above, I would say 8, 9, maybe get that handled first before you just start throwing IVs on board. Anyone who's got poor cardiovascular status or lymphedema, which means swelling in the legs, you want that checked out because they may not be able to deal with an IV form of anything, not just glutathione. And then anyone who just doesn't tolerate IVs, that's someone who's not a candidate for IV glutathione. But there are just so many ways to get your glutathione levels up, so no one should feel limited from that standpoint. So there are lots of different ways a functional medicine doctor can support you. And remember, even though we're talking about glutathione and adding it, this is a single nutrient or possibly a subset of nutrients to help this antioxidant level. However, your functional medicine doctor is going to do more than that. They're going to look at why are these things amiss and then get at the root cause while they're helping you to figure out the appropriate amount of glutathione or appropriate supplement to add on to support detoxification and oxidative stress. So anyway, I hope this was helpful for you, and it was wonderful to be able to share this information, and I look forward to speaking with you again soon.
Welcome to Root the Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rootthehealth.com.